All right, so the third part of our personal characteristics unit is interpersonal relationships and teamwork. So, interpersonal means it's between people, so these are our relationships with others. As we probably realize, this is a big part in our life. It doesn't matter if we're at school, work, our friend group, our families, strangers, we interact with all of them. Now, we also know that these can be positive or negative. And all of these interactions are going to have effects on us, whether it's physically, emotionally, or mentally. And how that interaction goes, whether it's positive or negative, is how that is going to affect us. Humans are social in nature, so we tend to enjoy spending time with other people. We benefit from that social interaction. However, sometimes we don't always do well at forming or maintaining interpersonal relations. Some of the benefits of having these good relationships are they can provide a sense of belonging and self worth. They help us learn to trust and respect others. And as a result, people learn to trust and respect us. At times, it can help us to step outside of our comfort zone and participate in new ideas. It does increase our self confidence if our group is lifting us up. It can help increase our physical health, provide support when we need it, celebrations when we need it, and overall, it just makes life more enjoyable. Now, if we have some of these negative interpersonal relationships, whether that's a romantic relationship, a friend group that clearly are not good friends, this is going to result in lower self esteem. We're going to feel powerless or worthless. We're going to start to question the sincerity of other relationships. So we would kind of wonder how someone could think something good about me if all these other people think bad things about me. We're going to feel more isolated. We're not going to want to participate in social activities. We're going to have a higher level of stress, potentially develop some depression. And honestly, having these negative personal relationships can cause physical illness, things like headache, chronic or ongoing pain, digestive disorders, hypertension or high blood pressure, insomnia, and weaken our immune system. So, how do we develop these good relationships? It's going to take time, it's going to take effort. This does not happen overnight. You have to be willing to work with other people, keep a positive attitude, learn to laugh at yourself. I know a lot of us have fears about certain things, but sometimes if we can just laugh about it, that's going to make a big difference. Listen when someone's sharing ideas. Be open minded, be willing to compromise. We're never going to get our way 100% of the time. Try not to criticize other people. Learn these good communication skills we've talked about and make sure we're supporting each other. Think about the relationships you have right now. You are never going to have control over what another person says or does. So, how can you protect yourself? How can you maximize positive relationships and minimize negative ones? It's okay to avoid people that bring that negative energy into your life. Kick them to the curb, tell them bye. We know that research shows that when we have more healthy relationships, we have overall better health, lower blood pressure, less anxiety, we manage our stress better, we have better control of our pain, we're less likely to be depressed and abuse substances like drugs and alcohol, and overall, we live longer, happier lives. Now, with those interpersonal relationships comes being able to work with a team. We know that in healthcare, we're almost always going to be part of a team of some size. Teamwork itself is when many professionals with different levels of education, ideas, and backgrounds and interests working together for the good of the patient. So everybody has a job to do, everybody's job is important, and working as a team is what gives that the patient that best quality of care. It's important to understand or at least be aware of the roles other people on your team may have. So we understand each other's responsibilities. We know our team goal. In healthcare, we might have some frequent conferences to make sure we're sharing our opinions and ideas and discussing options for the patient's best treatment. Now, leaders, which we'll talk a little bit more about in another unit, but in general, a leader is going to be a pretty important part of our team. They help with organizing and coordinating our activities, encourage people to share ideas, help solve problems, keep us in line with our progress, give feedback to make sure we're being effective, and a leader should be able to step out of their leadership role to let someone else step in if they're a better fit for the job at that time. Conflict is always going to happen, especially when we have different personalities, different backgrounds, different beliefs. Try to deal with it in a positive way. We're going to want to meet, talk it out, figure out the problem, use a mediator if necessary. So have a middleman come in who's unbiased, not on one of your sides, and just listen and help you communicate the problem. When you work in healthcare, there's always legal responsibilities. It is your job to know your own legal limits, know what you can and cannot do within the scope of your job. You have to work within that legal scope. You should never try to do anything outside of your scope of practice because that's illegal and you can be fired, lose your license, and potentially go to jail. I know that's a lot shorter than the things we've talked about so far. Thankfully, I think we've got the longer PowerPoints out of the way. But if you have any questions about teamwork or interpersonal relationships, just let me know and I will see you next time.